Well, I think one of the really important things through a person's ovarian cancer diagnosis is how best to kind of think about managing side effects and also getting support for the cancer diagnosis.
So I think this is a great thing to think about, and I think it's really very important in thinking about the person as a whole and making sure that we're not just giving chemotherapy to treat the cancer cells, but that we're truly treating the people who are in front of us. And we know that cancer treatments can come with a lot of side effects. And we know that cancer causes a lot of symptoms. And so it's our job not only to make sure that we're getting the treatment for the cancer, right? The chemotherapy, the surgery, the targeted therapies, but that, as you mentioned before, we balance this with the side effects that come with each of these. And so our goal is not only to keep people alive and to treat cancer, but to make sure that they have a good quality of life. And this means making sure that we not only talk about physical side effects that come with chemo and making sure that we're addressing those or making sure you're getting treatments for constipation or nausea, but also remembering that a cancer diagnosis is really hard. It's really hard from an emotional perspective and from a psychological perspective, and that it is totally normal to feel overwhelmed or sad or scared, and that it is absolutely okay to talk to your doctor about these things and to ask for help. And that we should be bringing these things up too and making sure that we're providing resources and care for all of you from inside to outside, head to toe. And making sure too that we are there to support the people who are supporting you, our caregivers,
Mhm.
because they play an integral role in making sure that you get the care that you need. And it can be really hard on everyone. And so if we can provide the support to you, head to toe, inside and out, and your caregivers, then we know that you will do better in the long run, right? And dealing with not only having a cancer diagnosis, but going through the treatment, being in surveillance and survivorship and everything, because we are here to make sure that we give you the support that you need for all of these aspects of your cancer care.
I would agree. I would just add that I kind of tell people that they need to kind of build their team. So,
Mhm.
their doctor may provide an element of it. They may have a nurse or physician assistant they work with. They may have a social worker or a
Mhm.
counselor, using these different support groups or mentoring programs. So there's a lot of different ways to think about all of those needs. And I always think you have to kind of build your team. It may not all be at the same place. And
Yeah.
nowadays it may be virtual or it may be online or, so I think that's such a really important point.
Yeah, I think that that's wonderful. And I think the bigger the network that you can build, right? And it's obviously everybody's comfort level is different.
That's
Some
true.
people have a small group that they need, and other people have a very big group. And I would encourage absolutely to ask for when you need help, right? And to find those people who help you feel supported and give you what you need, because it isn't going to come from one person. It is truly a team. You're absolutely right. And the other thing that I would mention, and we talked a little bit before, is about those palliative care folks,
Yeah.
right? And they play a very integral part in the care that we give, along with the nurses and the social workers and our psychologists and everyone else. And so um, we're there to make sure that you know that there are a whole host of people who are here to help you throughout your cancer care.